Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We have something that's extremely important for you to hear, and it's coming from Dr. Robert Ridgway, who's a veterinarian. He usually writes a column in our magazine each month, and this is a column will be in the February issue. And I'm very, very happy, Dr. Ridgway, that you took the time to do this one. Why did you think about it? Was there something special that happened?
No, I was just writing an article for the magazine.
Well, you sure picked it, and I don't think I've heard about this before, and I was just telling Dr. Ridgway, I think that every veterinarian office should probably have a notice about it. So why don't you tell everybody what it is? Mm-hmm.
It's an organism called toxoplasmosis, and it's spread in the feces of cats. And it's been recommended that any lady that is pregnant should not be dumping the litter while she's pregnant, because you don't know whether or not the cat is expelling toxoplasmosis cysts in the feces when it goes to the bathroom. So it's a no-no for pregnant women to clean the litter box while she's pregnant. That's bottom line if you just don't do it. Now, I had one gal, she was a veterinarian, and she insists that she was going to clean the litter box, and she did, and she had a normal birth. But I don't think it's worth the risk. That's my opinion.
And has this always been around, or is this something newly discovered?
No, this has been around a long time. Nothing new.
You know, there are litter boxes now that actually, I don't know how to describe it, that a cat sits on it and the litter is inside, and you don't clean it out the same way. You know, like when I had cats.
Yeah, it'll automatically clean. But the problem is some of those don't work very well, and so that's not a real good solution. I mean, we've had those and have used those, but it doesn't do a real good job of cleaning the litter. So the problem is ladies stop using it, and that's not good.
Right, and so I'm glad that you told everyone about this. Now, you do say that even if you're not pregnant, it wouldn't hurt to just use those gloves.
Yeah, sure. That's a good idea. You know, you never know what you're dealing with. When you're dealing with you can't. Everything is microscopic in size, so there's no way you're going to see anything. Once in a while, a worm is passed, but it's very rare that you actually see a worm from either dogs or cats.
So, well, let's just move this a little bit further. So, are there other animals that have the same disease in their feces?
There probably are, but it's not in a dog. It's just a disease of cats, domestic animals. There's no other animal that has it.
You did say in your article dogs can also be infected.
I did?
Mm-hmm.
No.
You did, so you wonder, of course we don't save their feces in a box the way we do cats.
No. And the problem is when it's in a litter box, it's all concentrated. Are you with me?
Mm-hmm.
And normally you'll take the dog for a walk, and some people clean it up, and some people don't. They just leave it.
Yeah, I know. Mm-hmm.
That's a real problem in our neighborhood.
Well, we are very fortunate. In our neighborhood, there's a big, long walkway, and I don't know if the city does it or the condominiums, but there are probably every 50 feet one of these bag receptacles.
Oh, yeah. Well, we have those, but they're not anywhere close to that. They're very far apart. You have to really go looking for it.
Mm.
But they're there, but very, very few. I think for all of this, I don't know how many people live in here, 11,000, but there's probably only 3 or 4 of those feces dumping stations.
Well, that's not very good. But here in Boynton Beach, I don't know where people have a lot of dogs. Someone is maintaining those. I don't know who's doing that, but it must be the city, and it does make a difference. Of course, there are always people who don't care, and they just And I have to say this to you, which it's not chauvinistic. It's mostly the men that just let their dogs do it and they walk away.
Well, I haven't found that to be true.
Sorry.
But if you say so, that's...
It's I remember my husband. I mean, he's a very good soul, but he would take our dog out, and I'd say, "Take these bags with you." He says, "I'm not going to pick it up." I said, "Are you kidding? Of course you should." And he didn't. He didn't listen. I think he kicked it over if it were on the sidewalk over to the grass. But that was just something. He was a good man, but that was one thing.
I find that some people let their dog go to the bathroom on the sidewalk, and it might be runny, watery, and so I'm thinking, boy, that's really gooey, and they're going to touch it. Well, if that's the case, that animal probably has hookworms. I mean, that's just a wag. It's a wild-ass guess, but that's a pretty good guess. If you got a watery stool, there's probably a parasite involved.
Well, let's get back to this about the cats. So, what about whether it's a kitten or it's a cat? It's all the same. They're all going to have that. How does it get to them? How does this terrible thing get in their system?
They have to be exposed to it, obviously. If they're not exposed, they don't have it, and they only expel it at certain times, and so it's not something that happens all of the time. It's just a off and on kind of thing that you find in the stool. I'm trying to find that article. What I said.
But that's okay. So the people are going to read the article in our magazine, and I think we probably covered it. But I'd like to take you to something else that's very personal and maybe get some advice. We have this Shih Tzu who has hot spots on his feet, two feet. And, they're red, and they lick, and he licks, and he licks. Is there something that's natural that I can...
That's not a hot spot, ma'am. That's a granuloma.
What is that? I'm sorry, what is it?
A granuloma.
What is that?
Well, that's a problem in River City, and it's very difficult to treat. I haven't found anything that works over the counter. I have bumped into some veterinarians who have a treatment for it, but some people have tried to cut it off, and that doesn't work. So it's a very, very frustrating piece of disease, and there's something that causes them to lick and lick and lick and lick. Now, sometimes on the feet, it's a fungal thing. If you look between the toes, it might be red. And if it is, you might try. You know what tenactin is? You can buy it over the counter. It's about $3 or $4 for a tube. And you put that in and it kind of burns. So it may react. If it's a fungus, they'll react to it. But it could be a fungus, and they're licking at it, because it itches. And I can't tell you what it is because, you have to see it and look at it. You probably ought to take it to your veterinarian and have them diagnose it. I'm
going to, yes. I think I got him as a rescue and about 4 months ago, and I've noticed it, but it seems like it's only on 2 of the 4 feet, which is interesting.
The front feet?
1 in the front and 1 in the back.
Uh-huh. Well, I don't know. It's probably either a lick granuloma or it could be as a result of a fungal infection. And there's no way to know unless you take it in. If you have a woods light, you can look at it, and Microsporum canis, which is a specific fungus, and there are multiple fungus. If you use a woods light and you look at it and you see apple green, that means that it is a Microsporum canis infection. But if it doesn't show green, it doesn't tell you a darn thing. You with me?
Yeah.
So, your veterinarian has an ability to run a culture. If that's the case, you may say that it's a leg granuloma, but I don't know. What you say right off the bat, you think first thing that comes to mind is a leg granuloma, and those are really difficult trying to get them to stop chewing. that particular site. They may have, I've seen them on their sides, on their legs, and they just keep chewing and chewing and chewing, and it's very raw.
Well, it doesn't seem raw. He just licks it a lot. And when I did look up some natural things, and one said fresh aloe could be applied. It couldn't hurt.
I don't think it's going to do much good.
Okay. Because you have to be careful what you put on there, because if he's licking it, you don't want him to get sick.
Yeah. I don't know what aloe has in it. I can't comment about that. I have on my cell phone a toxicology thing. Let me look and see what it says, if that happens to be in there.
Okay, because the other thing that someone said is to use some of the, certain vitamins that are to rub on them. I forget what.
That's hocus pocus.
Okay.
That garbage.
Okay. Now you're saying when the vet looks, there might be something he has to take internally, huh?
Well, he might take a sample and culture it. I can't answer. Aloe vera, is that what you're saying?
Yes. Uh-huh.
Well, that's generally mild to moderate toxicity: diarrhea, depression, anorexia, change in urine colors, tremors. Tremors are rare, but those are the signs that you'll find with aloe vera.
No, that's what you put on it. It's a plant, the aloe vera plant. It's aloe. It's the aloe plant, and it's very sticky, and you just put it on it. And
I understand that, ma'am, and that's what I just told you about.
And what did you say it does? It will cause that, you're saying?
It can cause vomiting, diarrhea.
Oh, well, we're not going to do that then. So I guess really I am going to take him to the vet. It just, I didn't notice it was as pronounced as I think it is now. So I wanted, because I think he had it when I got him, but it was much lighter.
Yeah. You never know. You just never know. But there are a lot of things that can cause them to lick. There's a grass fungus, they call it, or grass allergy. And so to try to see something through the telephone is impossible.
Sure,
so
I understand.
I can't possibly begin to tell you what it is or isn't, or what you should do or what you should not do. I would feel real bad if you took something I said and you tried it and it didn't work. I would be upset.
No, I'm not going to do that. I just thought maybe it was someone said their dog had it too, but I don't know what happened to it. But I think some of this is a Shih Tzu, but I think my Maltese, I had a Maltese and I had a Bichon, and they all seem to have what were called hot spots and little pink, things on their feet. But one of them, we actually had something from a vet that was a natural, the vet's not around anymore, but it was a natural ointment, and it did clear it up, but I can't remember what it was, and I'll just have to go to this vet and see. It could be very simple, but I'll look at it. I'll think about it.
Yeah, well, there's too many things that could cause that. But the first thing that I think of is a lick granuloma. But also, I know that fungal infections, which is you look between the toes and it'll be red. But a lot of things can cause red appearance between the toes, so that may not be of any significance or any help.
Okay, well, we covered that. Now I've saved up a lot of things for you, so you're fast on your feet, so I know you can handle this. This dog does not play with toys, and I always feel sorry for him, and he sits around. So I decided I was going to get soup bones and see if he wanted a soup bone. So I was going to make soup and get the bone. But I went to the grocery store. They said, well, you could just give him a plain soup bone with the marrow, and it's frozen, and boy, does he love that. These are, they're bones that you would cook soup with. And I give him one, and he plays with it. And I know it's safe because it's a big, one of those big, hard things. Because I didn't want to give him anything that he could choke on. And he can't choke on this. He can't, he just eats the marrow out of it. And then, so how do you think about that?
Well, there's a couple of things. It depends on how hard he bites on the bone, because sometimes it'll chip off. And I've seen bones get caught in the mouth, on the roof of the mouth, and get embedded into the top in the roof of the mouth.
Oh.
And it's real. I've seen that with chicken bones more than any other bone. But bones can break, and, I had this conversation with my wife's uncle, and he said, I was feeding dogs before you were born. You're not coming about bones.
Right.
The thing is, he didn't see what I see in the veterinary clinic when people come in after their dog have been eating bones. And I find that, number one, the bone is hard and it can break their teeth. That's number one. Number two, they might chip off a piece of that, and if they do, it's sharp.
Sure.
And it can damage the esophagus or the intestines. And so, it's a risk problem if you give bones. I understand where you're coming from, and a lot of, early on I used to think that giving them a bone would help knock the tartar off of teeth because they bite hard on it, and they put on it, and it's tough, and it'll kind of clean the teeth. But that isn't worth the trauma that the animal has if something goes wrong.
Interesting, because when I wanted to get him something like that at the pet shop, and he just gobbled it down. I was worried about that. I said, there's no way. He didn't hardly chew it, and these big things, they just went down. So I said, I'm not doing that. But it just seemed like this is one of those.
You know what bone marrow is, don't you?
Yeah. No, I don't. What is it?
That's where their blood cells are made. And then when they get older, it turns to fat. So the younger you are, you have more marrow producing blood cells. And so what he's doing is he's sucking up blood or premature cells that aren't ready to be put into circulation yet.
Really? So that's not even good for him?
Well, I wouldn't think that's the best thing to be feeding.
Huh. Thank you. I'm throwing him out. No, I think I'll cook soup, right? I'll make my soup, and I thank you. Isn't that interesting? I thought I finally found something that he would enjoy, and he has been enjoying it because he plays with it, So, interesting. Well, see, that's why I ask you these questions. It seemed like it was a perfect solution.
Yeah. Well, it might be some type of a solution, but it depends on when your bone marrow has either fat, or that's where our blood cells and animal blood cells are made. Now, if there's a bad problem, the spleen can produce some and the liver can produce some, and some of the fat will return back to producing cells. But you got to be pretty sick for that to happen.
Right. I'm not going to do it. In fact, I even got the kinds that are coming from cows that there's no antibiotics. They're out in the field. I was really being careful about this, what he got, but I think what you just told me doesn't make sense. I won't do that anymore.
Okay, well, basically you're feeding him blood.
Right.
Premature blood.
Interesting. That's why I guess that's why he cleans out the middle first.
Yeah.
He loves it, right?
Well, I don't know.
Well, he does. Well, it's been interesting. Well, I won't do that anymore because, he's a very sweet dog, and I don't want anything to happen to him. So that's what happens. A lot of us really love our animals, but we don't really know some of the things the aspects that you've always shared with them. And I would tell you that the nice thing that I have now is I have a groomer that comes to our home every 5 weeks and sits, brings her all her apparatus, and he gets groomed. And he absolutely, I think anyone that can have someone come to their home and do it is much better off than taking them somewhere else, and who knows what happens to them.
Well, as far as I'm concerned, it's less stressful. One of the things that pets become very accustomed to, they realize that when you put them in the car, they're on their way to the veterinarian because you never take them anyplace else. Right. And so they freak out. They have a lot of stress because they know where they're headed before they get there. It's a learned experience. Just from every time they get put into the car, they end up at the veterinarian, so they know where they're headed.
It's funny you should say that. Now, when we had our Bichon and our Maltese, we took them places, but they also went to a groomer, and they did not like the groomer at all. groomer wasn't bad, but they didn't want to have any of that done. They started shaking the minute they got in the car.
Yeah. Well, they knew. In your case, they knew they were either going to the vet or the groomer.
Right.
You know, that's the signal. Whenever they get put into the car, they're going to one of those two places because you never take them someplace else. Does that make sense?
It does, but this little Charlie absolutely loves to go in the car, and he doesn't shake. He's just he just goes in that car. I mean, and he sits there, and you take him out to the vet, and he likes the vet. He wags his tail all the time. He's a very sweet dog. So I haven't had a problem with him, but I have with the other two little girls that we had. Shih Tzus are very interesting dogs, aren't they? They come with their mouths are their jaws are very strong.
Yeah, you know, I forget the pounds per square inch that they're able to produce, but it's pretty significant. You think of a dog biting down a bone that can break a bone. That's pretty hard.
Yeah. And he's very friendly, and it's been a nice rescue for people. We're always promoting rescues here in Boynton Beach in Florida. When someone says they're going to buy a dog, I always say, why would you do that? Well, I want this particular breed. I said, well, they do have breeds that are rescued also you can get online, but I just think we have to take care of the dogs that are here already.
Well, it's a big problem, and I don't see that there's any one solution because everybody has a different opinion, and you know they want what they want, and they're going to do what they want to do, and that's just the way it is, you know.
Well, I do think it's selfish. I think that there are lovely dogs that are just dying for a home, and they make very, very good companions. But you're right. Some people like certain kinds of cars for certain reasons, but dogs are great. Now, the other thing I was really curious about is when I go to the vet, they usually have a cage with some kittens that I guess somebody dropped off and they're trying to get away. And they have them now on slings inside. The cats seem to love that. It's like a hammock.
Uh-huh. Whatever works. All kinds of different things have been used. Balls and little tiny mouse things, and you name it. If it works, they use it.
Yeah, and I think it's a good place to bring pets that need to be adopted to a veterinarian because you know the people go there, they love pets. Yeah. And
So the pet population has really grown in the United States. I had an article, I don't remember the numbers, but it's astronomical the number of pets we have now in the United States. It just and they become not just a pet, but they're part of the family. You know, they're one of the family members.
Oh, absolutely.
And the problem, as I see it, is if when they go, and they go frequently because their lifespan is shorter, it's traumatic. It's not an easy goodbye.
I know it, and it's because of the loyalty and because you take such care. If you really are a good dog owner, you've really cared for that dog. And it's very, very sad. I some people say, I'm never having another one. I can't go through that anymore.
Yeah, I know. I bumped into people who have had cancer and been treated for it, and then their pet gets cancer, and they said, I'm not going to put them through that, and they put it down. So, you know, everybody has their own belief and what they believe in, and they're going to do what they're going to do, and that's the way it is. That's the same way with finances, you know. They just do what they're going to do.
Yeah, I know you've been writing books on finances.
Yeah. You know, you had asked me a question. I wasn't really prepared for it. But I think on finances, I'm way off the subject here. But there's two things that I just a super simple thing. People do buy one of two things. Either they buy a liability, which takes money out of their pocket, or they buy an asset, which will actually earn more money. And then the poorer and middle class buy lots and lots of liabilities, and the more wealthy buy lots and lots of assets. That's super simple, but you try and convince somebody the difference.
So what kind of an asset? So we're talking about assets. What are you talking about?
Well, assets could be anything that's going to earn you money. That could be stock, mutual funds, real estate. There's many things that you can invest your money in that will give you a return. And if it gives you a return or compounded interest, then you're gaining financially. And you might call it, you know what? I can't think of it now.
What, Warren Buffett?
No, earnings that you don't have to work for.
Okay. Earnings you don't have to work for. That's fine. So it's like, I always say, it's like people used to say, when you buy real estate, you're working, your husband's working, and your real estate's working.
Yeah, you hope it's working.
Yeah, that's true. But you're right. Assets are very important. And I know you have written about this, and another time we can ask you why you've gotten so involved in that, and do you like that better than cats and dogs?
Well, no, I spent a career in cats and dogs.
Right.
And I have what I think is a foolproof system if you'll just follow it. But what I find is that people don't read, and when they do read or go listen to a seminar, they don't do what they learn.
Well, I think we ought to...
I don't know how you tackle it. It's just like you said, that some people just don't care.
Yeah, right.
How can you change that? You're not.
I don't know, but Dr. Ridgway, maybe next time we talk with you, we can do a whole seminar on that, and that would be interesting. So I'll tell Dan to catch you up on that another time. But thank you so much for being so friendly about all these things, and I'm sure there are enough people who will take some of your advice. So thanks a lot.
You bet. No problem.
All right, Dr. Ridgway.
Have a wonderful week.
Yeah.
Bye-bye.
Thank you. Bye.